here I said the most probable sign, they are objective sign. Objective sign, what is determined by physical examination by healthcare provider. So first one is uterus is going to get bigger size. So in this picture showing the uterus, so uterus when 12 weeks is just top of the pubic symphysis. When 20 to 22 or 24 weeks, uterus around the umbilicus. When 36 weeks, uterus going bigger in size and they touch the gymphoid process. So 12 weeks just up of pubic symphysis. 20 to 22 weeks, it is around or touch the umbilicus. When 36 weeks, it is touch the gymphoid process. But 40 weeks, the uterus is increased the size in side to side. So height is going little bit drop. So it is just below the 36 weeks. So this is occur because of increase the size of the uterus. And now go for what are the other most probable sign for NCLEX board. At least we have to know the Hicks sign should be positive, Goodwill sign positive, Chadwick sign should be positive, development should be positive. Also, Braxton Hicks contraction should be regular or irregular, but it should be positive. So I'm talking about what is Hicks sign. Hicks sign means softening of the lower uterine segment. Hicks sign softening the lower uterine segment here. So here the Hicks sign softening of the uterus, and Goodwill sign means softening of the cervix, and Chadwick sign means the blue discoloration of the cervix and external female genital organ or vagina should be blue discolored. It's called Chadwick sign. Goodwill sign is softening the cervix, and Hicks sign means softening the uterus. And here I said the sign Chadwick sign, this is at least basic. Here is showing the Chadwick sign is a blue discoloration of cervix, vagina, and also the labia, blue. And Hicks sign also here is showing softening of the cervix is known as Goodwill sign. And here showing the ballotment, right? And also the cervix become more vascular and blue discoloration in Chadwick sign. So here showing the ballotment. Ballotment means the rebound of the fetus. Again, the examiner finger on pulpit. So when examiner feel, right, it is the examiner finger, they can feel on their hand. This is called external. But sometimes examiner do the internal ballotment like this. So here, so what they do, they put the fingers called digital examination, right? Put the finger and they can feel the baby. They can feel the baby. So this is called internal ballotment. It's called internal ballotment. So this should be, both should be positive. And Hicks, also the Braxton Hicks contraction, it is irregular, painless contraction throughout the pregnancy, but quickening the first time when mother feel the movement of the baby. And also during the continued the pregnancy, abdominal enlargement, very common, abdominal striae. So this is the mark, right? Striae, stretch mark, because of pregnancy. Uterus is going bigger and bigger. And also the skin pigmentation change. And positive, definitely the if mother go for pregnancy test, it should be positive, right? And it should be HCG, human choriogonadotropin hormone should be positive. This is the most confirmatory test. So what are the positive signs for pregnancy? One is the fetal heart sound. So when mother go to the clinic and they can find it out by Doppler study, right, or ultrasound. So by find out the fetal's movement or fetal heart sound by ultrasound or ultrasonography. This is the most confirmatory test of pregnancy. So fetal heart sound, sometimes NCLEX board asks a question, when first fetal heart sound is detectable or find out. When 12 weeks, 10 to 12 weeks, we can find out fetal heart sound by Doppler study. This is the Doppler study, right? And also NCLEX board asks a question like this question, what are the normal fetal heart rate? The normal fetal heart rate is 120 to 160 beat per minute. In case of normal healthy person, it is should be 60 to 100 beat per minute. Fetal movement, also we can find it out by palpation or ballotment, or we can find out by ultrasound. But fetal movement we can feel by second trimester. Also, the last positive sign is the ultrasound of the fetus at the 6 to 8 weeks. Fetus identification should be positive, but heart sound should be get 10 to 12 weeks. An early positive method of pregnancy diagnosis or most confirmatory test is the ultrasound, right? So